YouTube comments from a video titled, Medical System is About to Collapse. How to Save Yourself. Part 7.
And Mark 639 wrote,
It can't be fixed because of cost of university prices have to be sky high. In Europe, university is free. Drug prices are 10 times higher than Europe. Private insurance is unsustainable. It's not for health. It's for profit.
At Marcia Baker 6153 wrote,
Love you three. So do not take what I'm going to say as direct at any of you at ALL. BUT. I do not think doctors nowadays have gone into the profession because they care about people. I think they have gone in because it's great money. I know just nurses alone can almost write their own check because they want more nurses. Doctors have always made really good money. From the personal attention I get when I am standing/sitting in front of any doctor, I can tell they are not interested in what's wrong with me. They do not physically touch me unless there's no way around it, and then it's like I have leprosy, one finger quickly. They don't listen to heart or lungs. They don't do anything. They ask what's wrong, then either prescribe a med or a specialist. That's IT. I'm absolutely positive the insurance is driving you all crazy. And I think RFK Jr. or whoever is in charge of that end of the medical profession needs to immediately do a deep dive into all this insurance BS. Between insurance and pharma, people are dying for no good reasons. As always, thank you, gentlemen. Always love to hear what you have to say. Just wished you practiced in Las Vegas, Nevada, lol. I do not trust AI, and I have already seen AI be wrong on a lot of things. So, do not trust it for the most. I don't even use any of the AIs like ChatGPT or whatever. Just the one that pops up with Google, and I don't even want to use that one but have no choice.
At Kristen Haynes 407 wrote,
As an older person in Britain, I feel written off by the health service. I am no longer important because I am beyond working age. The NHS is underfunded, and a number of services are now only available to those on higher incomes who can afford to pay doctors. I paid NHS contributions for my entire working life, yet now I am asked to pay a second time to private doctors. I find the system takes a could be this, could be that, try this, try that, instead of providing accurate diagnosis. Twice I've suffered horrendously for years with late diagnosis that ended up only being diagnosed when I was rushed into the emergency unit and operated on immediately to save my life. They saved my life, but an awful lot of damage was done to internal organs. My career was ruined, my life so badly affected. When patients complain, those in power and authority take little/no notice. We do need more doctors speaking up for the suffering of patients. Doctors have more clout than patients. Doctors/nurses have protested a few times in the UK, but they have been protesting about a pay rise. As much as a pay rise is needed, I have not seen medical staff standing up for patients much. In the UK, they did not train enough doctors and nurses. Insurance? I paid insurance to travel, and once, when I was taken ill in another country, it was an absolute nightmare dealing with the insurance company. Only the wealthy get efficient healthcare now. The rest of us are treated like dirt. I feel a lot of people suffer and die on waiting lists, suffering and deaths that could have been prevented. Greedy corporate companies are ruining the health services. They want to take money from patients, but not pay out when patients are ill.
At Ankabostonariu 6550 wrote,
Plus the fact that the lawyers are telling doctors how to talk and what to do to protect themselves against patients. There is no alliance with the patient to treat his diseases. We are defending against each other rather than working together.
At Babashini 3634 wrote,
BRS. What can be said about a person who names the floors of her facility after Satan? We all know evil is taking over. Absolutely shameful. TRS should be delivering the care they are meant to deliver. An OT hurtful care.
At Sunshine US wrote,
That is the way it was when I was growing up in a small rural southern town. That was in the 1960s. The doctor would know what was wrong after an exam. He was always correct. You might have to go to a specialist. But your doctor had diagnosed your problem correctly. He also made house calls.
At Janet Clark 5668 wrote,
I hear you. I'm thinking about skipping the yearly free half-hour primary care checkup this year. I get diagnosed with strange conditions, such as undiagnosed hypertension, unvaccinated for COVID, frail. The frail one is really funny because this summer I did a 4-mile walk, and out of 467 women, I had the second highest age-graded score.
At Hartmank wrote,
I'm an RN for 35 years. My mom took the drug DES to prevent miscarriage. I have been a victim of Big Pharma. I worked in primary care and watched Big Pharma come through the office wanting DRs to prescribe. I saw the greed. When COVID got here, there's no way I would take the jab. I lost my job over it. I don't trust Big Pharma. I've worked in insurance as well. DRs are run by corporations. So sad. Profit over people.
At Skylark 72 LS wrote,
I have been a nurse for almost 30 years. I've said it from the beginning. It's all about the money. Doctors are given an algorithm, and most are unable or allowed to think for themselves. All we do is check boxes in charting. Hospitals are so concerned about their brand. The competition is top priority, as are all the scores that we now live by. Also, hospitals have been trying to make the buildings look and feel like hotels. It's such a waste of resources, and it's not functional or necessary. I'm in my later 50s and obtained my MSN in executive nursing so I could survive until retirement by not working at the bedside. It's all going to get worse with AI, which I believe they will use to reduce staff to cut costs. There is nothing wrong with growth and innovation, but it is being done for all the wrong reasons. I will not be sad when I'm no longer working in healthcare. New nurses don't want to work hard, and statistics are showing many leave the profession in 2 years. I won't get started on what AI has done. The focus is on all the wrong things.
At Sharon Olson 5782 wrote,
You're not just 3 doctors, there are hundreds of us. The employee doctors are the ones who are in debt from medical school, or they are the older, very corrupt doctors like an oncologist in Hawaii who kills patients.
At Java Zombie wrote,
I absolutely CAN and OT agree with you when you state that most doctors get into medicine because they want to help people. I happen to know a LOT of physicians, including my own SIL, who are in the business F or teach $dollar alone. Now, being the capitalist that I proudly am, I have no issue with anyone making a reasonable profit. Not many wake each morning, leave their family all day just to do for others for free. I sure wouldn't do that often, and I would have no expectation of anyone else doing such a thing. Volunteering my time and talents is absolutely something that I will do and enjoy doing for worthwhile causes as often as possible. However, I'd not be willing to do so at the peril of my own life and family obligations. That said, I couldn't agree with you more that the medical industrial complex is collapsing. After speaking with my dermatologist that I've seen for 25 years yesterday about my thyroid issues that my current GP and endo docs seem to not comprehend nor care much about, he wrote me the name of HIS doctor and told me to go see him. His doctor is a doctor of medicine who has moved away from allopathic medicine and into practicing functional medicine. It appears that his doctor, along with 6 other doctors, have stepped into practicing together. Allopathic medical doctors do not ask the question. LETs find OUTWHY and attack the FIX of the root of this problem. That is what we need. We need to get back to whole body care #1 and treating the root of the problem. Ugh. I'm exhausted from a long day and won't make much sense if I keep typing. So, since sleep is vital, I'm going to hit the hay for now. Keep heading in the direction that you 3 men are heading. Stick together and keep speaking out as well as learning. See you in the next video.
As Small Rabbit Musings wrote,
It is all us, the patient's, fault that we get quite so sick. I'm fat. I recently went through a complete hysterectomy for womb cancer where I found my blood pressure was too high. I could have reduced seed oils, sugar, and ate more organic beetroot and moved more. I didn't. I never needed to go to doctors. Then I crashed. Food is very unhealthy in the real world and society encourages drinking. At the moment, I've reversed a lot of consumption but haven't lost weight recently. We all need to know how to get better.
Dallas Ryan 1485 wrote,
1 meal a day here at age 71. No sugar and very low carbs. Daily walk 3 to 6 miles. Only taking HBP meds. But blood pressure is getting better and better. Visit my doctor once a year. One thing for sure is you, the patient, need to educate yourself. Almost all the power for good health is in your hands. There are many YouTube channels like this one providing good information.
Danny Connaughton 7928 wrote,
Too late here in UK. We rely on a registered, qualified nutritional therapist and personal trainer same person. Nowadays, for our health. I'm nearly 72, my wife 70.
Sharon Olson 5782 wrote,
Insurance would not even exist if it weren't for doctors. That's why the insurance went around and bought up doctors' businesses and put the rest of us out of business because doctors are allowed to go out on strike. As soon as that was determined and Obamacare gave insurance power, we lost the practice of medicine. We must demand the return of our business. For our patients' sake.
Lindalian Wright wrote,
As technology gets better, medical care gets worse. Insurance and pharmaceutical companies weigh too powerful in affecting medical care. How sad, how well-spoken and thoughtful these 3 doctors are. Thank you.
Rapturebound 197 wrote,
Thank you, Diaz. I know you take this situation very seriously. It puts you in a difficult position to have to speak out, but your professional and personal care, concern, and integrity demands you sound the alarm. Thank you for your courage and your guidance.
Audiofileman 7047 wrote,
You could call this an American tragedy in the making. I find myself recoiling from the current practice of medicine. Unless I can find a doctor who believes in nutrition, lifestyle, and supplements, then I will go my own way. I haven't found one yet.
Darm07 wrote,
I quit bothering with doctors years ago. I would take my mother to her doctor's appointments, and they were a joke. I couldn't get her to stop bothering with them. I'd reschedule her appointments and push them out months because they were a waste of time and money.
MPDND 1335 wrote,
There is definitely not enough good doctors and doctors that care. They are booked up, retiring, or have already retired. What is left is medical personnel that provides what I would term almost worthless care. You could easily die waiting for them to figure anything out. The doctors themselves are going to have to unite and rebel against the system. However, good luck with that when they are saddled with debt on leaving medical school. It is the dependency that was taken advantage of. The cost of medical school has to be greatly reduced and the system revamped.
At Georgia Boros 263 wrote,
We need to get rid of the profiteers in medicine, the corporations and the multi-millionaire not-for-profit CEOs. Neither gives a damn about the patient. The system needs to return to control by true not-for-profits, the ones that were run by churches and nuns who took oaths of poverty, and physicians.
wrote,
U.S. Congress gets TOP medical care and they make THE rules and regulations and don't give a damn about the plethora never held accountable FORTHE corruption in THE system. IT will GET much worse. Kickbacks ISTHE and result. Dollar 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 dollar.
At Tamar Myers P6I wrote,
That would be amazing if I didn't have to go through all the nonsense and answer the same questions every time I go. 10 minute appointments. Like drive-thrus. That's what I'd be into.
At Dryermum 6673 wrote,
I graduated from medical school 39 years ago and saw the decline in medicine firsthand. My physician father said one of the things he loved most about being a doctor was his autonomy. He also warned that insurance companies would ruin care. He was right. 15 years ago, I left mainstream medicine and opened my own practice without accepting money from third parties. Patients happily pay $28.16 with card, check, cash, or Bitcoin for a doctor's full attention for an hour or more. If they can't pay, I treat them anyway, as my dad did. I have fond memories of a farmer my dad treated who couldn't pay but who brought us fresh eggs for years. I'm not rich, but I love my work. Medicine is still exciting. There's still so much to learn. Doctors, consider opening your own practice and serving patients, not insurers.
At DRJPMC Laughlin wrote,
Thank you all for this honest assessment of things. I am a 65-year-old executive coach, and I cannot bring myself to spend any more time in our dysfunctional healthcare system. I know enough about health, wellness, and business to spot a scam when I see it. The medical establishment sees its clients simply as sources of revenue to be exploited. So, I am embarking on my own path, doing my own testing, and looking fruitlessly so far for a physician I can trust. Wish me luck. These are perilous times to be in need of healthcare, so I intend to remain healthy for a very long time through my own choices and best practices. Side note, Dr. Sunil, I lived in the UK for a year in the 1990s and had the best healthcare ever. So sorry to hear that has been lost as well.
At user BJ3DR6GV7Q wrote,
Personally, I want to see more healers and holistic practitioners. More of a push toward whole foods, exercise etc. by doctors for once. But with Big Pharma, FDA, and Big Ag having so much control and influence, it may not be possible.
At Japoho 1958 wrote,
You think your medical system is broken? Try taking a look at the Canadian medical system, especially in BC. Many of us cannot get a family doctor, including me. I'm a cardiac patient.
At Judith Wire 389 wrote,
40 years ago, American cultural commentator Neil Postman predicted the coming technopoly, which would take over everything to the detriment of the population. I work in education, and it's the same thing. Technology has entered into everything so often to the detriment of the task at hand. Wait until AI really gets its claws into medicine, making the Silicon Valley moguls even richer at our expense. The Medicare Wellness Questionnaire and its stupid cognitive test is a product of the Rand Corporation, which is a very large defense debt contractor. What does such an organization have to do with healthcare? Money.
At Iron Rose 888 wrote,
I'm a former nurse, and I'm a T2 diabetic. Only one doctor gave me a low-carb diet to deal with my diabetes. Since I went low-carb, intermittent fasting and exercise, now my blood sugar levels are more stable. I used to be vegan, and I had a roller coaster of blood sugar and mood swings. I'm 70 years old, and I just want a diagnosis. I will research for medical remedies and find a solution rather than take medication. My doctor gave me a statin drug and insisted that I try it. I felt horrible, muscle aches, and I couldn't function. I felt like I had the flu. After 2 weeks, I quit taking it. I don't trust the medicine or any doctor pushing pills.
At JCIL4 wrote,
Realized years ago that insurance was dictating my medical care. Have been researching ever since to be my own advocate. Not easy, but often shocks any medical professional I have the misfortune to encounter. Allows me to say no to unnecessary or dangerous directions and suggest natural or simple solutions.
At Kim Greenlee 4064 wrote,
I don't trust anything a medical doctor has to say. I try to educate myself all the time with more holistic information. I go to the doctor to get one RX for migraine, which I'm trying to fix now for almost 20 years, and also to get some labs so I don't have to pay out of pocket. No offense meant, but I always leave there thinking what a joke. And I'm 68 and all the stupid questions they ask over and over, it's like, what even is this? When I first started with Medicare, they said I would get a head-to-toe exam. I asked what that entails, and they really had no idea. And by the way, there was no exam. Then later I saw the head-to-toe phrase in some literature from Medicare. They are like robots. In fact, I often leave the doctor's office wondering if they are really doctors. I wish I had the money to just stay outside the system and find a good holistic doctor. But all of them are out of pocket and they charge outrageous fees. All of our systems in America are failing. Agriculture, healthcare, education, and why? Because of corporations and corrupt government. And the medical doctors are trained by pharma. I think they are trained wrong. They don't try to heal anything. Just diagnose and match a drug to it. And that's the system. And that's why I also watch your channel, because you talk about this stuff and give good advice.
At A Sweet Mystery wrote,
Stop the medical school government monopoly, and you will end the shortage. Any qualified institution should be allowed to churn out as many qualified doctors as they want, and allow patients to bypass doctors and use intelligent diagnostic systems/AI if they choose.
At JSXS5HQ wrote,
1 until YOU doctors start hounding. YES hounding. OUR legislators. AT every level. Nothing will change, BUT only become worse. Doctors need TO join THE fight. GT involved indie hounder legislators. WHOARE fixated. ON food dyes. IN Fruit Loops. LOW hanging. Fruit Loops. 2. YOU doctors. WHO favor AI integration. Will EAT your words. Once every doctor will ASKFOR approval ONALL treatments. THE insurance companies. ARE button holing our. Legislators TO make their AI programs AS Teach E-Treatment Approval Gate for Medicare, ND Medicaid patients you. Doctors ARE jazzed about online patient access TO healthcare information. HAS IT crossed your minds that NOT every senior OR per senior HAS access TOTHE Internet? Please DO better research ND stop advocating FOR only teach E techno privilege 3. Please stop preaching TO teach E choir ND take OFF those delusion rosy glasses GET educated about THE real world ND please GET involved. Join THE fight ATTHE legislative level where change can occur. Become part of THE solution. WE greatly appreciate your channel. BUT take action YouTube talk changes nothing.
Abihislav wrote,
The same thing is starting to happen in the mental health system. I am also trying to hold up patients who are physically hurting, who have to wait months to get into a doctor for real care. A few gave up, left the state, many because suicidal, could not hold jobs due to the pain. In mental health, the medical systems are trying to take over with 15-minute sessions, monthly that does not do anything, to large national groups diving in, spending a ton in lobbying, and wow, all this takes away our ethical work. The insurance companies do NOT care. It is a battle. I also spend a ton of time fighting with insurance companies. They deny all the time. That takes away from my time to be with the patients while I am on hold for hours. I am seriously thinking of moving to a different country.
At Lara O'Neill 7284 wrote,
TYS O much DR and FO are addressing these problems. Also, since I refuse chemo to treat my breast cancer, my oncologists don't even want to talk to me at all.
A Jimmy Younger 618 wrote,
The insurance company's attempts to dodge responsibility is beyond absurd now. After an invasive surgery, they argued the anesthesiology portion did not have prior authorization after they had authorized the surgery itself. The idea that anyone would go through this surgery without anesthesia, or that anesthesia was an issue apart from the surgery they authorized, was stunningly ridiculous. Only after being leveraged by a threat of legal action did they acquiesce and cover their obligation, which was clearly spelled out in their EOC, evidence of coverage document. Part of me wished their representative had stood firm, because the potential windfall of punitive damages for operating in such bad faith can be a surprisingly generous award.
A doctor, Julia Hyakarsik 8862 wrote,
The solution is this: stop mandatory deduction from our paychecks to Medicare Social Security. Leave those dollars in the patient pocket. When patient needs healthcare, patient pays cash. Fire the administrators who add zero value.
At a Sweet Mystery wrote,
A large problem with health insurance is that people are signed up to a generic plan by their employers. They have no idea of their coverage, so of course their claims are often rejected. All insurance should be self-chosen, with specific coverages chosen in a cafeteria style, and completely self-paid. Also, insurance companies should be able to pick and choose their customers and their coverage, in a completely free market, as they see fit. This would require insurance companies to be explicit in their coverage, and for people to actually be aware of what coverage they have.
A Peggy Rap 3029 wrote,
I called my doctor to make an appointment and found out my doctor left, and it surprised the whole office, so I had to get another doctor, but then they gave me a temporary doctor cause I wanted to see one right away, and next year the company Cigna got bought, so I don't know what kind of doctor, same one, different one, I don't know. But I've been researching a lot of medical information, and I'm taking care of my own health as much as I can. I need to get off some meds, so I have to go through the doctor, but yeah, it's on us now. I see exactly what you're talking about. It is a meltdown coming. I hope it will get better.
At Marie Christensen 8390 wrote,
Doctors come to see you for minutes. After a PA does everything, What rights does a P perform duties that a DR graduated from medical school is supposed to do?
At William Tyndall 1402 wrote,
Sadly, the most dangerous thing a parent can do is see a doctor. All too many just want to issue the drugs the computer says to prescribe, and many are still pushing the experimental mRNA gene drug.
At Matthew Hamilton 9832 wrote,
Last year, I went to a local hospital that is a part of a huge health system in the area for a hypertensive crisis BP of 214 by 140. The person in the intake area of the ER treated me like a criminal interrogating me why I had a BP log. I told them I was instructed by my cardiologist to keep a log. The hospital did very little to help me and in fact discharged me from the ER with nearly the same BP as I walked into the ER with in the first place. Now, I will refuse to go to the hospital based on this experience, even though I know the dangers of not being treated. I also stopped seeing my doctors, as they only sit at their computers and never even physically examine the patients. I truly hope things change in the medical profession, as I personally can't trust my doctors or hospitals around me.
At Ranger Girl I2HP wrote,
The medical system has been broken for 20 years. I have not been in good health since my 20s. I'm now 50 years old with the health of an 80-year-old, and doctors seem to be less capable medically than they did 40 years ago. I don't expect to make it to my 60s, and if I do, I'll consider myself lucky. Doctors don't even listen to you anymore, and insurance doesn't cover anything anymore. So there is that.
At Dorneb 5315 wrote,
For a long time, I have used this saying to help me see the humor in dealing with the medical world. THEARTOF medicine ISTOMUS THE patient until nature takes ITS course.
At Jeffrey Dye 181 wrote,
I think we will have to have a group of many doctors to advise and help us along with our own healthcare. It's going to take a long time, but better to start now than later. I'm experiencing learning as we speak with what's next for my health. We do need a network source of doctors to help us with this new journey. Soon, hopefully.
At Leslie Clower 8544 wrote,
I'm a retired RN. The medical machine has lied to people deliberately for financial gain. I will never trust them again. They murdered millions of people because of their greed. Never again.
At Lori Marcus 3525 wrote,
My doctor's office a couple years ago started the My Chart system period. Prior to that, I never knew what they had stated in their notes after I left. I have been so shocked and amazed. I'm going, they will say things that they say they've talked to me about, and they never have. I don't know, I guess they're covering their butts or something. It's not one doctor, it's been a couple of doctors. Maybe this is a new way they learned in school to cover themselves, to make the insurances happy or something. I don't know what the heck is going on.
At Donna Bermerman 1423 wrote,
I had a doctor near DC that used my chart and used this to communicate with his patients. I moved to South Carolina, and my new doctor also used my chart. I thought, great, I can have my new doctor take a look at my previous doctor's medical notes on my care previously. Nope, each doctor's office can only see their current patients in their care. I suppose privacy is part of it, but it could be a helpful tool if you have a complicated issue.
At Dave Boggs 2000 wrote,
Union think it's not your job as people enjoy their denial enabled by Big Pharma. Unsustainable comes to mind. How about tell the truth? You get one body, take care of it, with diet and exercise, or learn to deal with your thanatophobia.
McLaren 1 wrote,
A. Never use AI for anything. It is 100% demonic. To the core. B. Your spiritual health. Where you spend eternity is the only decision that matters. Jesus said, unless a man is born again spiritual birth, he cannot see the kingdom of God. You must ask Jesus to save you. By not asking or outright defying that Jesus is the Son of God will get you eternal lake of fire. Do this, NOW.
At NMB 955 wrote,
Same with vets. Have many recent complaints, including my dog and cat died within 1 week of seeing the same vet. In the same week. There was nothing to suggest this might happen. Extremely let down.
At Marianne 2630 wrote,
For those who say take care of yourself and stay away from doctors, good luck with that if you're ever in a car accident or some other kind of calamity that isn't your fault. I've had more than 15 major surgeries, many of which have failed, since the car accident that nearly killed me. I wish I had died, frankly. My life has been a nightmare. I'm a veterinarian, so I know how to fight for what I need medically, but it's nearly impossible to get attention for what you need. Coordination of care is a myth.
The Buzzer wrote,
My first doctor I remember came to our house. I was 5 years. I remember him due to the storybook he gave me. A small semi-hardcover about eating right, playing outside, help others, listen to your mom/dad. It had 10 pages, lots of pics, and inside the covers were 12 band-aids inside the front and 18 smaller ones inside the back. The doctor was Daniel Slater. His kid's book was Dr. Dan the Bandage Man. I stayed with him till I was 18. He retired. I then found Barry. He would give you 30 minutes, and his waiting room is where he waited for you. Well, he retired. Now what? Luckily, I was told about Dr. Joe Q. I was 51 at this time, however, at 70, Joe retired. Damn. Well, I found another DR, but it's been 6 years now, and I'm 76 year. Tony is a younger, 48, but not what I'm used to. Not the same as my past three. My older DR and I were first name. I know their wives, kids, moms/dads, as they knew mine. With Tony, my now 6-year DR, I've talked with his wife a number of times, just about things. Tony gives me 10 minutes and looks everything up on the computer. It seems at times he's unsure of himself. I'll stay with him a while longer, but if no changes on his part, I will start looking.
At Becca 595 wrote,
I don't refer to it as the healthcare system anymore. I don't trust it. I call it the disease care or sick care system. Just treating the disease and lining the pockets of the big pharmaceutical companies by the multi-billions and not addressing the root cause. The relevant passage in one version of the Hippocratic Oath states, I will use my powers for the benefit of the sick according to my ability and judgment, and I will keep them from harm and injustice. Is making it increasingly harder for ethical and sincere doctors who really care about preventing disease rather than treating it to keep the oath. The system has become a greedy modern-day travesty.
At Love Being 543 wrote,
Sorry, girls, not buying. We have never had a healthcare system since the witch hunts and the installing of Rockefeller military medical universities. I am sure you know this being you are medical doctors and not health doctors. Medical doctors are bed partners with Big Pharma and Big Ag. The gig is up, girls.
At Doubting Thomas MX8SL wrote,
I gave up on doctors and Medicare. I have not seen him in over a year. Last time he said he has 7 minutes with me, then 45 minutes on the computer. He said he has 1,500 other patients. During the COVID pandemic, he tried several times to take the mRNA jabs. I refused. He told me vitamin D3 was dangerous. He took 3 jabs and got COVID 3x. I never got COVID, and I never took the mRNA.
At Faith 5846 wrote,
The people that have money can go to homeopathic doctors, and most of them are DOs. The alternative homeopathic doctors are glad they got out of the system. They many times offer 4 vitamins, prolotherapy or PRP, hormone treatments and other treatments that work. Unfortunately, this can be expensive.
At Sharon Stein 2370 wrote,
I pay a monthly fee instead of for each visit. She has agreements with different testing facilities. This makes the tests less than a quarter of what I would pay with insurance. She responds to communication usually within less than an hour.
At Lori 6156 wrote,
New diag. Nope, changed mind. It's this diag. Even though X-rays reflect first diag W specialist WKG 1 week a month. This is ridiculous. One doctor for each body part. None of the doctors talk to one another. The patient has to go from specialist to specialist and explain everything 5 times. By the time they're done, they're still not getting the medical care that they deserve. It's a shit show.
At Laura Hanks 9127 wrote,
We will see how much Medicare insurance will go up this year. Also, the supplement plan. Might have to drop the supplement plan. Thanks for your care. Laura in Phoenix, AZ.
At Ivana Pantino 273 wrote,
Australia has a similar electronic records system called MyGov, but it encompasses every government service you can imagine, including taxation, pensions, property titles, etc. Personal health data can only be uploaded by written consent of the individual involved. Since many Australians don't trust government to be responsible with their data, given several instances when data has been stolen, many have not given their consent. It feels more like invasion of privacy and tracking.
Charlie Fry wrote,
What sort of a person thought up a money-making scheme to profit from the sick? To even keep them sick by poisoning them with quack drugs? Pure evil.
At Clover Girl 7934 wrote,
I won't get flu, COVID, pneumonia, shingles, etc. Inoculations any longer. I just don't trust any of them. People think I'm being negligent, but I don't care. Every other commercial on TV is hawking a new drug. It's all about money. If they find out down the road that it's harmful, oh well, it's risk assessment. So what if they get sued and have to pay out millions? They've already made billions. They just roll the dice.
At Ren Little 8826 wrote,
For those commenting here to look after your own health, I did my whole life. I was very fit. Until COVID hit me. It affected my heart horribly. I am now disabled and can barely manage everyday chores. I used to do 4 5K walks every week, hike at least 10 hours per week, work heavy-duty manual labor full-time, cared for my extensive garden. I was conscious of my diet.
At Nosretep 1960 wrote,
Haven't been to medical except injuries and required job exams since childhood. Haven't been AL except ingested since before I quit smoking 35 plus years ago. I have no need 65 required to be on Medicare or fines. Don't use it.
At Warning Signs 4526 wrote,
Medical cartels started by Rockefeller, and the books and tests are controlled by a demonic pharmacia, sorcery, witchcraft system. Natural remedies are the best. You cannot patent nature and make money if God creates it. So patients are stuck with wizardry and poisons posing as a cure. Vaccines are causing suffering for a lifetime. Polio was caused by vaccines. Beauchamp proved all vaccines cause harm. Pasteur was a Freemason. The smallpox scam/hoax. My God, the rabbit hole is so deep. I stay away from them 100% unless a real emergency. That's it, and I am 70 years young with no sick insurance. I invest in real health. red light therapy, Rife machine, DMSO, Holga Clark's parasite detox today.
At Linda Ramius wrote,
Even 6 to 7 years ago, I was able to call a specialist, such as a gastroenterologist, for an appointment without having to go to a primary care doctor for a referral. I needed PT recently, and I don't have a primary care doctor. I seldom see doctors, but I could not get PT without a PC doctor referral. Ridiculous. And no one answers the phone anymore. How did our medical system get so messed up? So much more, but enough for now.
At Mark Byerly 9094 wrote,
Test, diagnose, prescribe. Apply the prewritten standard of care paradigm. No thinking required. In fact, thinking is discouraged. Discuss possible causes with the patient. LOL, surely you jest.
At Buzzer wrote,
Insurance. Sometimes it's coding. I think the biggest problem is greed. Some doctors are getting paid from the drug companies to write scripts on the drug. Hence, doctors will write a script for the payoff, need it or not. The doctor will invent a health reason, so it's okay for them to write a script for their pocket, not your health. Greed. I think a lot is due to the Obamacare. Just seems the SHTF around that time.
At MyBiz 1006 wrote,
Are you all in the US? I wonder how much of this is because of government involvement in the insurance industry. Also, I wonder if health outcomes will get worse or better because of collapse? Will people begin to take steps for their own good health? I'm only sorry that patients with actual need and good doctors like yourselves may suffer the most.
At Gina 5319 wrote,
I have a friend who has had a stroke and recently had a heart attack. They told her she needed bypass, but her arteries were so small that they couldn't do it unless she had another event, and they could do it as an emergency. Why would they wait and have to do surgery as an emergency instead of in a more controlled setting? They put her on a blood thinner, sent her home, and told her to come back if she gets worse. She is scared to death. Crazy times.
At Pamela McDonald 9603 wrote,
Rural America is hurting for physicians. NPs on every corner. I agree with you all. I worked as a director for a 5-physician clinic. Sold out to hospital system, and it was a nightmare. At my age now of 63, it is like no one wants to fool with older adults.
At Also Maduda Jensen 3689 wrote,
I totally agree with what you are saying. I have been watching good doctors leave the medical system for the last 8 years. I have finally taken charge of my own health this past year at age 76, working with a trusted chiropractor and ordering my own lab tests. Have completely changed my diet to keto and lost 30 hash. I am really enjoying using new keto recipes. Also love to do my own research into health and well-being. I was interested in your ideas on AI and technology. My only issue now is high cholesterol after discontinuing statins, which my PCP knows. Was able to go off BP meds and readings at home are good. I really laughed when you talked about the Medicare wellness exam. It really is a farce. And all of us elders worry about remembering the 3 words and drawing the clock face at 11:10, which doesn't help our BP readings. I was glad to hear a bit of hope in your conclusion.
At Nansalewin 2002 wrote,
Don't be fooled. It's the criminal doctors that are leading the charge. Doctors ARETHE problem. I never met a cardiologist or endocrinologist who didn't lie to my face to keep me sick. Stop making excuses for these criminals.
At Grumpy_Nurse wrote,
Watching systemic collapse is like watching a slow-motion train wreck. I am a nurse who protects my health by distancing from the health system and using my knowledge to keep myself well. It is safe to say the insurance companies have transformed healthcare into a con game that makes patients sicker with every visit and every treatment. When did insurance companies gain the power to dictate medical treatment?
At Tim Nestor 3005 wrote,
At 61 years of age, I took a factory job and opted out of insurance. I'm in perfect health on a carnivore diet. I see no need for a doctor ever again unless I break something. Insurance is a scam.
At Shelley Vanderveld 3764 wrote,
Canada's healthcare doesn't sound quite as dire as the American healthcare. I don't have a doctor at the current time because I moved from Alberta to British Columbia, so I'm on a wait list. I haven't figured out how to get prescriptions when I should need them, but when I did see doctors, they did talk to us. We didn't have piles of forms to fill out, although they probably did. They preferred us to keep our visit to one problem and to make another appointment if we had multiple issues.
At Julian Lefebvre K1D wrote,
I'm a doctor, and Healing Beyond the System book by David Collins completely changed how I look at health. It's one I suggest all my patients to read. I've seen both myself and my patients benefit from the principles inside.
At Ania Shenanigans 3815 wrote,
The insurance scam is probably the biggest. The cost to process it has pushed the corporate takeover of small hospitals into these huge conglomerates that are owned by private equity and only operate to make a profit. People are quitting in droves and workers are getting scarce. The new ones coming in are woefully inexperienced. The third largest killer in the US is medical error. And now with so many of these for-profit places dropping Medicare Advantage, the actual care for people is going to be a huge collapse. Look at Vermont. There is only ONEMA plan that is accepted in the whole state. And that is only in SIX counties. The rest of the state is out of luck. Anyone blaming providers needs to get an education about the history of insurance and what it's done to our healthcare system and the burden to the taxpayer. Obama pushed the ACA, and this was the worst thing that happened to us. I would rather have what we had before. It was far less expensive. The big thing was to cover all pre-existing conditions. That is what they said, anyway. But the reality was that insurance companies saw this as a way to make billions of dollars off the government.
Jeff is 9HN wrote,
There is no reason today to run to a doctor for any ailment. You can learn how to take care of your own health if you spend the time and do the work. You can't avoid accidents, but your health is up to you.
At Zarababayev 8397 wrote,
I am in practice for 26 years now. My life and my practice of medicine improved over the years, but that was because I spent 16 years slowly building my favorite medical home. However, my communication system deteriorated since amount of required communication increased enormously, and my little private office is not keeping up with it anymore. My paperwork load also increased tremendously. Also, I am an exception to the rule. I am fiercely independent, have a loud mouth, and have serious problems with authority since teenager years. I see how my friends are retiring, and my junior colleagues are becoming salaried clerks inside big hospital machines.
At 88 Sunset Strip wrote,
Read the book, Undoctored by William Davis, MD. The best thing to do is stay away from doctors unless you need stitches or have a broken bone or are in a car crash. Eat carnivore. Do not eat plants. Do not eat anything in a box. No sugar. Get in the sun.
At Joel Martin 2826 wrote,
Thankfully, I'm checked out on reading my own blood work twice a year. I get very little sugar, including complex carbs, plus minimal alcohol in my diet, couple drinks per month. I do cardio and resistance recording it on my Garmin watch. What I worry about is my iron deficiency anemia getting the best of me before simply getting an apt with hematologist. I've tried for 2 months, and no one returns my calls. I'm at least happy I know what I know about myself, but that's absurd for a relatively simple problem. Usually solved by supplementing iron in the morning. I live in LA and really appreciate your show, Dr. Hand et al.
At Debbie Jones, 6134 wrote,
Big business today fought the love of money and not the health of people. It starts with college. How can they educate every person for 13 years at no cost but for specialities? Like doctors, you have to go in debt hundreds of thousands of dollars. I know a lot of poor people who would make good doctors because they do care and would love the opportunity to help people, but would not stoop so low to be owned by big corporations telling them how to treat their patients just to pay off their educational expenses. I think we need to bring back the ethics into the system. I try to stray away from doctors, but if I can't, I do my own research first, then during and after. I don't hesitate telling them they don't know what they're talking about either.
At Wendy Zinks 47 wrote,
We lived in a decent-sized town in Indiana. It has 2 large hospitals. I rarely go to the doctor outside yearly checks. There were 3 times in the last several years when my personal doctor, 2 Lowell urgent cares, and the CVS could not fit me in for something urgent. I felt I had no accessible medical care, and my emergency room was really bad.
At Frederick Schwartzendruber 1999 wrote,
For profit businesses sucking out $30 billion out of the healthcare system every year can be solved only by turning healthcare into a non-profit system, removing profit as a major factor in how patients are treated.
At Esther Stotterlong 8149 wrote,
I am a retired ON. I completely agree with all 3 of you. I started working at a hospital in 1990 when we handwrote our notes. Then the computer system started years later. I have watched nurses do as little as they could. To me, that was neglect. I left nursing because I saw too many people coming in and out so many times. The medical system is broken, and I want no part of it. I'm almost 70 and I changed my diet and go to the gym 3×/WK. I do have a great DR and no problems getting an appointment. Thank you for talking about this.
Petus 3410 wrote,
I tried to get into med school late 90s, but they were already focused on DEI. Ended up going into tech. Still wish at times to be in medicine, but you can't really practice it anymore. You're dictated on how to treat patients. No thanks.
At Agnes Young 2917 wrote,
It's a sad state of affairs when I have to do serious research as to what potentially could be wrong with my health and what the reasonable treatments are before I even enter the doctor's office. 99% of the time, the doctor is clueless.
At Jim Siverts wrote,
Everyone needs to get out of the medical system as soon as possible. The entire system is designed to drug symptoms and not fix causes. I'm a 70-year-old carnivore. Sugar is the primary cause of all of the common medical issues, and I have none. My interaction with the medical system is 0. The only things in my medicine cabinet are toothpaste and contact lens solution. I take 0 pills, prescription or over the counter. I haven't taken a pain med in 25 years. If all you do is stop eating carbohydrates, you will be skinny, and that alone will fix most of whatever problems you have.
At Joanna Pigliavento 7930 wrote,
As a medical biller, each morning I feel as though I need to put on my battle armor to fight for my providers to be reimbursed as a patient. I opted to pay monthly for a DCP. I don't see her often, but when I do, she spends 2 hours with me. She does not have to push meds, vaccines, or screening tests on me. It's expensive, but I prioritize my health. Rate episode doctors. I respect and appreciate you all.
At Dennis Estremer 3597 wrote,
My orthopedic DRs said they had to join one of the larger corporatized hospitals just to continue practice because of the cost of malpractice insurance. And Y is horrendous for pretty much anything.
At Catherine Portland 503 wrote,
So besides sitting there, get a medical movement going. DRs and nurses against them all. Talking on here is a very small step. Get your own organization started. All of you have money, so you don't get it when you don't have it. You can eat healthy, which is more expensive.
At Onga 2433 wrote,
Healthcare, not healthcare these days. It's people that have no medical training trying to run patient care. The big CEOs who make big dollars have never even worked in patient care, but yet tell you what you need to do with your patients.
At Cleo 325 wrote,
This is unfettered predatory capitalism in its final stages. Doctors check boxes written by lawyers and are required to follow the mandated protocol in order to get paid. I imagine if your practice is owned by a private equity firm, you as a doctor have to meet productivity goals. I assume you need to make referrals to other specialists in your group and meet prescription quotas based on arbitrary guidelines like the age of the patient. Unless you own your practice, there is no autonomy. Even if you are independent, the insurance companies impose their requirements.
At Health 9818 wrote,
Haven't you been to a doctor in more than 15 years and still have to pay for health insurance just in case of an emergency that would wipe us out financially?
At Ob 1947 wrote,
I've been listening to you for quite some time now, and I want you to know that I appreciate all that you are doing and saying about the medical industrial complex. I have witnessed much of what you have discussed firsthand. Thank you for speaking up.
At DC 9291 wrote,
Chronic pain FAR infrared light bulb $40, $50, and heat lamp $10. Joint pain / deterioration. I needed knee replacement, now I don't. Far infrared for bone / deep tissue. Near infrared for eyes / muscles, sinews, and other stuff too. Car crash / fall from ladder, etc. Still require hospital. Dentists becoming an option.
At the Macker 894 wrote,
Such valuable information. I'm 100% with you. I get a fax referral from a local hospital, and it's 15 pages long. I have to dig through it to find the 3 or 4 words indicating why this person was referred to my office. Nuts.
At Fatbomb 7832 wrote,
A couple of things my wife and I, both retired, have it happen recently. My family doctor works in a clinic with several other doctors. She is regularly booked a month out or more. Her office won't let us see another clinic doctor, but instead tells us to either go to the ER or urgent care. The ER takes hours from start to finish. The urgent care doctors where we live also have their own practices and patients with appointments, so it can take a very long time to see someone. The second thing is my wife has been on a low dose of Synthroid for 20 years after thyroid surgery. When she needs a new prescription, she gets her labs, then sees our family doctor for 10 to 15 minutes max. On the recent Medicare claim statement for a routine refill, it reads 1. Procedure description, procedure code, established patient office or other outpatient visit with straightforward medical decision making. IF using time, 10 minutes or more, 99,212 2. Established patient office or other outpatient visit with moderate level OF decision making. IF using time, 30 minutes or more, 99,214.